Hey PreMed STAR, this is Dr. Gupta, and I'm here to answer the 5 big questions.
What is your specialty and what training was needed for you to become that?
I'm a pulmonary and critical care physician, so basically I get to spend time in the intensive care unit, taking care of patients in the ICU, as well as in the pulmonary clinic, taking care of patients who have pulmonary-related conditions like COPD, asthma, interstitial lung diseases, lung cancer, and the like.
Describe a typical day on the job in 30 seconds or less.
A typical day on the job right now looks very different than it did for me in the beginning. When I first started, I was a critical care-based doc mostly, so seeing patients in the intensive care unit, doing procedures, just taking care of patients on the inpatient side. Now I'm mostly clinic-based, so it's like an 8:30 to 5:30 type job, doing patient care and doing a lot of other sort of projects that keep me very happy and engaged. Lung cancer screening, COPD classes, pulmonary hypertension projects, and a lot of other projects that keep me very highly engaged in my job.
What was your biggest challenge on your journey to becoming a medical doctor?
There's a lot of challenges on the journey to becoming a medical doctor. I think for me it was really striking the balance between family demands and a lot of stuff that was going on in my life at the time when I was in medical school, in residency, and beyond. So it was really key for me at the time to strike that balance between taking care of really important home things and also taking care of myself and taking care of my education. It wasn't easy, and looking back, it's even more remarkable to me that it all came together the way it did. But certainly something I'm very, very proud of.
Share one of your most memorable medical moments.
There are a lot of really big medical moments. There's taking care of patients and having a lot of great stories and experiences with saving lives and stuff in the intensive care unit and in the clinic. But really, there were some great stories in the journey. And the journey to me was quite capped off after 4 years of medical school, where my peers and we made an end-of-year graduation video at the end of 4 years of medical school. And these were people I didn't know, I wasn't even really friends with. And we just, we became friends. And it was in that process of medical training and becoming friends, we put together a really funny outline and a skit that was Grey's Anatomy themed. And we had a lot of fun with that. And that will go down as, of medical stories, one that's just really positive and joyful in what was a difficult time.
What is the single biggest piece of advice you have for premeds?
The biggest piece of advice I have for premeds is staying laser-like focused and not comparing yourself. We're all so driven and competitive and super talented. And invariably, we see people around us who sometimes are more driven or less, more talented or less, and we begin to self-compare. And that's dangerous. We need to stay focused. And so my recommendation for you guys is to put your blinders on. Don't talk to other people about how did the test go, or what schools are you applying to, or how did that interview go. I mean, do it in a general way, but be really careful about comparing, because it ends up really eating a lot of people apart. It definitely affected me, and that would be advice I would give to anyone now, is do not get into the game of comparisons.